Hey there. So, awards season has already started.
Good evening, and welcome to the 82nd Golden Globes, Ozempic's biggest night.
And okay, I did not watch the Golden Globes this year, but there is an awards show that's made basically just for nerds like me.
Hello, everyone, and welcome to the 8th annual Shkreli Awards.
The Shkreli Awards, named after the pharma bro Martin Shkreli. Remember him? He became famous, infamous, in 2015 when a company he ran took over the making of an old drug called Daraprim. Old. Introduced in 1952, but it later became used to prevent a form of pneumonia that people with HIV can develop. So Martin Shkreli jacked up the price from $13.50 a pill to $750. Rings a bell, right? So who gives out awards named after that guy? Answer, a healthcare think tank called the Lown Institute. One of their big recent projects was ranking nonprofit hospitals by how much they do to earn their tax exemptions, for instance, by giving out charity care. The Institute's president, Dr. Vikas Saini, hosts the awards ceremony.
So if this is your first time at the Shkreli Awards, this is our top 10 list of the most egregious examples of profiteering or dysfunction in healthcare.
I'm telling you, this is an awards show for nerds just like me. In fact, it's also like a celebration of nerds kind of like me. Each one of the awful stories these awards are highlighting was dug up and brought to light by journalists.
So this year, the journalists behind these stories will be receiving a Shkreli Reporting Award. And I have one in my hand here.
It's a bobblehead, a white guy in a black suit, like Clark Kent without the glasses. And it's in a display box that says 2024 Shkreli Award. Someday, I hope the reporting we do here earns us one of these. The ceremony was held January 7th. We're going to bring you some highlights. Is it a highlight when you're giving out awards for the worst things? Well, let's just say these were some of the most entertaining stories. And we've got some reflections from a conversation I had with Dr. Saini the next day. The ceremony itself wasn't fancy, just a Zoom presentation, but we're going to dress it up a little bit so it sounds like other awards shows with, a big crowd and a stage.
All right, so without further ado, let's do the countdown, the 2024 Shkreli Awards. Brace yourselves, here we go.
This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman, I'm a reporter, and I like a challenge. So the job we've chosen on this show is to take one of the most enraging, terrifying, depressing parts of American life and bring you something entertaining, empowering, and useful. The Shkreli Awards show is a countdown, starting with number 10, and they started with a doozy this year.
Number 10, Texas Medical School allegedly neglects to notify next of kin before selling body parts of the deceased.
NBC News reported that the University of North Texas Health Science Center in Fort Worth was getting unclaimed bodies from the county coroner and then cutting them up and selling them without getting anybody's consent.
The center's business supplied the body parts to major for-profit ventures like Medtronic and Johnson & Johnson. The investigation found repeated failures at the center and at the county level to contact family members who were, in fact, relatively easy to identify and reach.
For instance, NBC talked with the family of Carl Honey, a veteran who died homeless but was entitled to a military burial. Here's what happened instead.
Swedish medical device maker paid $341 for Honey's right leg. A Pittsburgh medical education company spent $900 for his torso, and the U.S. Army paid $210 for bones from his skull. Just sounds so macabre. It's more like a Halloween story.
When NBC News told the university what they'd found and that they'd be publishing their findings, the medical school shut down the program and fired the people who'd been running it. But as Vikas Saini reflected when we talked, this probably wasn't a story about a few rogue administrators. It sounded to him more like a really grisly example of how healthcare institutions get run.
They set a tone at the top that's, we got to make our numbers. We got to make our bottom line. You know, it's like the widget factory and, you know, how many cars did Tesla ship? With that mentality, you set the tone. Once you set the tone, you can't keep track of what everybody's doing. And the people probably thought they were doing the right thing. They're trying to bring in some revenue.
If your job is to bring in revenue, help make the numbers, then why would you bother trying to contact next of kin and get consent before selling off somebody's body parts? And this was a state medical school. As we'll see, as you know, this theme, gotta make our numbers, it's going to run through the whole awards ceremony and through so much of healthcare. Next on the list, another banger.
Number 9. Out of the mouths of babes, a taste for tongue-tie cutting intensifies.
I'd never heard of this, but in some infants, the little bit of tissue that connects the tongue to the floor of the mouth, it's a little thicker or shorter, and that's called a tongue tie. And the New York Times reported that lactation consultants have sometimes advised new moms to have tongue-tied babies snipped to help with nursing. And the Times reported the procedure has exploded in popularity.
Despite a lack of evidence showing effectiveness, baby tongue-tie cutting procedures are being touted as a cure for everything from breastfeeding difficulties to sleep apnea, scoliosis, and even constipation.
New York Times reporters talked to one doc who says he does this procedure 100 times a week at $900 a pop. Dentists also do a lot of these, and a medical device maker named BioLays apparently was encouraging them to do more. Here's Dr. Saini from the awards ceremony again.
At an April 2024 event for pediatric dentists billed as Tequila and Tongue Ties, representatives for the laser device company trained attendees on the procedure before doing rounds of tequila shots and margaritas. I should add that, they had a 3rd annual frenectomy fiesta, which was advertised as Nacho Average Dental Meeting.
Later, Vikas Saini told me this story actually stirred some deep reflection that goes back to the Lown Institute's origin story and his own. The Institute started as the Lown Cardiovascular Research Foundation, founded in 1973 by Dr. Bernard Lown, a cardiologist who advocated for non-invasive management of heart disease and who became Saini's mentor.
Dr. Lown's motto was, we do as much as possible for the patient and as little as possible to the patient.
Saini appreciates how doctors and researchers want to discover new things, but in our system, that desire gets wrapped up in the medical industry's need to make the numbers, find new products to sell, like procedures.
These procedures take off, especially if there's a need or a plausible facsimile of a need, in this case. And once they take off, it's sort of snowballs.
So tongue-tie cutting looks to him like just an especially wild version of the product development side of things. And an event like Tequila and Tongue Ties just strikes him as a natural extension.
This idea that the manufacturers train people in the technique, that's not confined to this. This goes on all over the place.
We could dig up probably a trove of tongue ties and tequila shots like events.
Yeah. Gallbladders and gimlets.
Here's another example of a product in search of a market. This story was dug up by Arthur Allen, reporter with our pals at KFF Health News. And in this case, the product is a drug.
A drug company pursues high dose of profits despite risk to patients. That's shocking. Amgen's lung cancer drug, Lumakris. How do they make these names? Lumakris? There's Ludicrous, Lumakris. Was granted accelerated FDA approval in 2021 at a daily dose of 960 milligrams.
But the company also had to test a much lower dose, 240 milligrams, which turns out to work just as well, with a lot fewer side effects.
That should be good news for patients looking to reduce the diarrhea, nausea, vomiting, and mouth sores that can occur.
One patient told KFF Health News, after 2 months on that drug, I had lost 15 pounds, had sores in my mouth and down my throat, stomach stuff. It was horrible. So yeah, a lower dose sounds like great news. not for Amgen. KFF Health News reported that by selling the higher dose, the company makes an extra $180,000 per year per patient. So that's what they're doing. At the awards ceremony, Vikas Saini said the story shows weaknesses in the FDA approval process. It's long and expensive, but it's not comprehensive.
There's no way of holistically looking at how much does this cost, what are the side effects, what are the trade-offs, and what's the strength of the evidence. We need different mechanisms and methods than just saying, hey, you're approved. You can charge $1,000 and we'll figure it out later.
Before giving final approval, the FDA has asked Amgen for extra studies. But meanwhile, the drug is on the market and the FDA-approved dose on the label, it's the higher one. So we've heard about procedures and drugs getting pushed that may not be the best for patients, but do make money. And then there's this story from the New York Times about folks selling products that don't seem to even exist.
Here's the story that's going to piss people off, perhaps. In 2023, a massive surge in Medicare billing for urinary catheters left patients shaking their heads. Up to 450,000 beneficiaries had bills for catheters submitted on their behalf, representing an 800% increase over previous years. Just 7 suppliers were responsible for $2 billion of these suspicious charges.
That $2 billion? The New York Times story says that could amount to a fifth of all Medicare spending on medical supplies for that year. That's just 7, quote unquote, suppliers.
When the New York Times looked into these suppliers, the curiously named Pretty in Pink Boutique, they found no medical business at its address, and its phone number rang a random auto body shop.
The Times found that Pretty in Pink had billed Medicare for more than $250 million. I said to Saini, this example seems to show, like, this kind of fraud, maybe you don't even have to try that hard.
I think it just illustrates, the dollar flows through healthcare are so massive, multiple trillions of dollars. That $1 billion here, $1 billion there, it's not even real money yet.
So with trillions of dollars moving around and a lot of people who need to hit their numbers, we get high-priced drugs that may not be worth the money and body parts sold off without anybody's consent, and folks getting procedures they may not need, companies billing for catheters no one seems to have gotten. And of course, the Shkreli Awards honored more winners, including a doctor accused of giving patients drugs they didn't need and which killed them. There was an insurance company that denied a claim for an air ambulance ride for a baby, leaving the family on the hook for more than $97,000. That's another one reported by our pals at KFF Health News, with NPR this time. And there were 2 stories about hospitals beholden to private equity investors. One has been accused of denying care to cancer patients and demanding payment up front. The hospital denies that allegation, but NBC News found their charity care policy had been altered in 2023 to exclude cancer treatment. And as bad and ridiculous as all this sounds, still ahead, we've got the top 2 honorees, dishonorees, and some bigger thoughts from Vikas Saini about what it all means. That's right after this. An Arm and a Leg is a co-production of Public Road Productions and KFF Health News. That's a nonprofit newsroom covering health issues in America. KFF's reporters do amazing work. They've broken lots of Shkreli Award-winning stories. I'm honored to work with them. The other private equity story in this year's Shkreli Awards involves a chain of hospitals, Steward Healthcare, that ended up bankrupt. The Boston Globe published a heartbreaking story with the headline, "They died in hallways, in line, alone. Their deaths are the human cost of Steward's financial neglect." The Shkreli Awards gave their #1 spot to Steward's CEO. Well, now he's the former CEO, Ralph De La Torre, who reportedly made $250 million over the 4 years leading up to the bankruptcy. And they illustrated the story with a photo of an empty chair with a name card for De La Torre in a congressional hearing room. He skipped the hearing. He was reportedly on one of his yachts at the time. and he got held in contempt. It's a hell of a story. But if I had gotten to vote for the top spot, I would have gone with the company that became the runner-up.
Number 2, corporate healthcare behemoth exercises crushing power. So what started out as a small Minnesota health insurer is now the 4th largest business in the nation by revenue, controlling nearly 90,000 physicians and acquiring influence across the breadth and depth of the healthcare industry in the United States.
90,000 physicians. That is more than 3 times as many doctors as work for the VA. And of course, that company is United Health Group, which also operates the country's biggest insurance company, United Healthcare, and a bunch of other healthcare businesses. We have talked a lot about United on this show in the last couple of years. And a team at Stat News, that's a news outlet covering health, medicine, and science, they did a massive series on United in 2024, documenting just how big United has grown and how its tentacles interact. For instance, United Health is the biggest player in Medicare Advantage. That's the privatized version of Medicare. You're in a United Healthcare Medicare Advantage plan, your in-network doctor is likely to work for United Health Group. Stat interviewed some of those doctors who said they felt pressured to, 1, spend less time with patients, and 2, okay, the second part needs a little setup. When you run a Medicare Advantage plan, you get extra money, a bonus, for insuring patients who are less healthy. So the second thing these docs told Stat was they felt pressured to use aggressive medical coding tactics to make their patients look as unhealthy as possible, which could earn that bonus for the insurance plan.
According to Stat, this tactic may have allowed the company to take tens of billions of dollars in additional payments from us, the taxpayers, over the past decade. United Health faces a federal lawsuit for this behavior, as well as an ongoing antitrust investigation. And of course, the company denies any wrongdoing.
When we talked, Vikas Saini said if he were working for United, he might pursue the same kinds of strategies. That's how you hit your numbers, how you keep shareholders happy. It's the logic of so much of our healthcare system. It was the logic of Martin Shkreli, the guy who gives these awards their name. Shkreli did eventually spend 7 years in jail, but it wasn't for jacking up the price of medicine.
People say he went to jail and they link it to the pharma pricing thing, but he didn't go to jail for that. He went to jail for this other thing, securities fraud. So it may be, raising the price that much was perfectly legal. And then that puts a different spin on his justification, which is he felt it was his duty to his shareholders to maximize what he could make.
And by the same logic, United owes its shareholders maximum return, so it grows bigger and bigger. And other players, they're trying to hit their numbers. They try to grow big enough to compete.
Now, maybe someday, we'll have 3 behemoths duking it out. But again, people left holding the bag in all these healthcare sort of Godzilla versus King Kong fights. The people left holding the bag are patients, communities, smaller hospitals, rural hospitals, and most of us, really.
When Godzilla and King Kong fight, they stomp on everybody.
Yeah, exactly.
Meanwhile, United has been in the news recently, in a big way. In December, the CEO of the insurance division, Brian Thompson, was shot to death in New York. I mean, you probably heard about it.
I'd characterize my mood or my reaction in response to that shooting to be one of alarm and urgency. The urgency is that we've been doing the Shkreli Awards for, years and years and years. The kind of anger and the kind of simmering resentments, they've been there for a while. And that's what I'm alarmed about, because we got big problems. We need people to come together to help figure them out. It's a flare being shot up to say there is a crisis, and to call it anything less than a crisis is not real.
Vikas Saini sees this crisis as an extension of how our health system works. Everybody hitting their numbers. And he asks, yeah, but numbers of what?
If we're going to treat healthcare as a commodity, and we're going to have the magic of the marketplace solve all these problems, which some people still think is the way forward. I happen to disagree in many dimensions. But according to the logic of the marketplace, what's the product off the assembly line? With a commodity, if the product is healthcare activity, healthcare procedures, then we have the system we have. But what if the product were health? What if the product were wellness?
We don't measure for that. Vikas Saini thinks again about his mentor, Bernard Lown.
He was always fond of saying that in most other businesses, you get more efficient by doing everything faster. And he said, in healthcare, at least in the doctor-patient relationship, you get more efficient by doing everything slower.
Meaning by taking time to really get to know patients.
The quick example is, if I know someone for 10 years and they come in Friday at 4:30 with a headache, I have one response. If I've never met this person in my life and they come in Friday at 4:30 with a headache, I'm more likely to send them for a CT scan or see a neurologist or whatever the hell it is.
In addition, and in contrast to the Shkreli Awards, the Lown Institute gives out a Bernard Lown Award for Social Responsibility. That award honors a young clinician under the age of 45 who stands out for bold leadership in humanitarian work and standing up for justice. If you know somebody who could be a match, the deadline to nominate them for the 2025 award is January 31st. Speaking of deadlines, we had a big one on December 31st, the end of our year-end fundraising drive. We were racing to hit a big target. Between the Institute for Nonprofit News and a few super generous donors, there were funds to match $30,000 in gifts. Did we make it? We sure did. Or I should say, you did. Thank you so much. Because of your generosity and commitment, we are starting out 2025 super strong. Starting with, we are bringing back the First Aid Kit newsletter and making it weekly. That starts in February. I'm super excited. Meanwhile, we're starting an extremely cool partnership with KUOW, Seattle's NPR news station. They will be helping more people discover this show as a podcast. No immediate plans for a broadcast version, but this is really big. In just the first few days, we are seeing lots of new folks listening to An Arm and a Leg, and we're literally just getting started. If you're one of the folks who's discovered this show with help from KUOW and the NPR network, welcome aboard. I am so glad you're here. We'll be back with a new episode in a few weeks. And meanwhile, feel free to dig around in the 100 and some episodes we've published in the last 6 years. I think they're all pretty good. I'll catch you soon. Till then, take care of yourself. This episode of An Arm and a Leg was produced by me, Dan Weissman, with help from Emily Pisacreta and Claire Davenport, and edited by Ellen Weiss. Adam Raymunda is our audio wizard. Our music is by Dave Weiner and Blue Dot Sessions. B. Bosco is our consulting director of operations. Lynn Johnson is our operations manager. An Arm and a Leg is produced in partnership with KFF Health News. That's a national newsroom producing in-depth journalism about health issues in America and a core program at KFF, an independent source of health policy, research, polling, and journalism. Zach Dyer is senior audio producer at KFF Health News. He is editorial liaison to this show. And thanks to the Institute for Nonprofit News for serving as our fiscal sponsor. They allow us to accept tax-exempt donations. You can learn more about INN at inn.org. Finally, thank you to everybody who supports this show financially. You can join in anytime at armandalegshow.com/support. And here are the names of just some of the people who pitched in before the end of 2024. Thanks this time to Wendy Turner, Sean Hecht and Rebecca Weicker, Mary Uva, Karen Weissman, thanks sister, Laura Grandin, Thomas Swift, Blake Eskin, Jackie Gardner, Lex Martin, Ann Maggio, Haley Young, Wet Moser, Wendy Greenhouse, Arnie Weissman, my brother, Mary Gail Thomas, Elizabeth Feldman, Linda Spielman, Lloyd Brodsky, Jeffrey Lieber, Elizabeth Main, Frida Furman, Adam Milgram, Sarah Pekovsky, Eve Podette, the one and only D.B. Cooper, Cindy Peterson, Katerina Mesarovich, Heather Matthews, Adam Schwartz, Charlie, Jenny Fever, Jean McLaughlin, Sean Gowers, Mavis J. Huang, and Erica Y. Huang. Thank you so much, and thanks for listening.